Have you ever wondered if your penis size is average or if certain habits could be harming your sexual health? You're not alone. Many men are misled by myths about their bodies, myths that can affect self esteem, relationships, and overall well being. But here's the truth, most of what you've heard is wrong. In this video, a female urologist will debunk the most common myths about the penis, setting the record straight once and for all. Stick around until the end. You'll be surprised by what you learn. Subscribe and like to see more videos on this topic. Myth 1. Penis size is the most important factor for sexual satisfaction. Many men believe that a larger penis automatically leads to better sexual experiences. Society often reinforces this idea through movies, advertising, and even casual conversations. However, research and clinical experience show that sexual satisfaction is influenced far more by emotional connection, communication, and mutual understanding than by physical size. For many partners, intimacy is about trust, attention, and emotional closeness, not measurements. Overemphasizing size can create anxiety, which ironically can interfere with sexual performance. The urologist emphasizes that confidence, self acceptance, and understanding your partner's needs are far more important than obsessing over inches. Myth 2. Masturbation frequently causes erectile dysfunction. A surprisingly common belief is that frequent masturbation weakens sexual performance or causes permanent erectile problems. In reality, masturbation is a normal part of sexual development and adult sexual life. It can even help men understand their own bodies, desires, and sexual responses, which improves sexual health overall. Problems arise only when masturbation becomes compulsive to the point it affects relationships or daily functioning, which may indicate underlying stress, anxiety, or psychological issues. Men should focus on maintaining a healthy balance and avoid unnecessary guilt over natural sexual activity. Myth 3. Erectile dysfunction only affects older men. While erectile dysfunction, ED, is more common with age, it is not exclusive to older men. Stress, anxiety, lifestyle factors, poor diet, sedentary behavior, and certain medications can trigger ED at any age. Younger men experiencing ED often feel embarrassment or shame, but it is a medical issue, not a reflection of masculinity. The urologist explains that simple lifestyle interventions like improving sleep, exercise, and diet can make a significant difference. Early consultation with a healthcare professional is also crucial to rule out underlying conditions such as diabetes, hypertension, or hormonal imbalances. Myth 4. Penis pumps permanently increase size. Penis pumps are frequently marketed as a solution for men who feel insecure about their size. While these devices can temporarily enhance blood flow and create short-term enlargement, they do not produce permanent growth. Improper use can cause bruising, pain, or even vascular damage. The urologist emphasizes that men should be wary of marketing claims and focus instead on maintaining healthy sexual function through evidence-based methods. Confidence and sexual skill are far more impactful than temporary devices. Myth 5. Circumcision reduces sexual pleasure. There is a persistent myth that circumcision diminishes sensitivity or pleasure during sex. Clinical experience shows that circumcision does not have a significant effect on sexual satisfaction for most men. Pleasure depends on a variety of factors, including arousal, technique, emotional intimacy, and communication with a partner. Decisions about circumcision should be guided by personal, cultural, or medical reasons rather than fear of reduced sexual enjoyment. Myth 6. The penis cannot be injured. Some men assume that because the penis has no bones, it cannot be seriously damaged. This is false. Penile fractures, while rare, can occur when the erect penis is bent forcefully, rupturing fibrous tissue. This type of injury is extremely painful and requires immediate medical attention. Awareness of safe sexual practices and gentle handling can prevent these injuries. The urologist stresses that understanding anatomy and risks is an important part of sexual health education. Myth 7. Over the counter supplements can cure erectile dysfunction. Many supplements and herbal remedies claim to improve size or cure erectile dysfunction. Most of these products are unregulated and lack scientific evidence of effectiveness. Some may even be harmful, containing undisclosed ingredients that interact with medications or cause side effects. The urologist warns that the only reliable ways to address ED are through lifestyle changes, professional diagnosis, and approved medical treatments. Self medicating with unproven supplements can delay proper care and potentially worsen the condition. Myth 8: Penis size determines fertility. Fertility has nothing to do with length or girth. Male fertility depends on sperm count, motility, morphology, and overall reproductive health. Worrying about penis size is irrelevant when considering fertility. The urologist encourages men who are concerned about their reproductive health to focus on maintaining overall health, avoiding smoking and excessive alcohol, and seeking medical advice for proper evaluation. Understanding this myth can reduce unnecessary anxiety and improve mental well being. Myth 9: Tight underwear harms penis health. While there's a belief that tight underwear damages the penis, moderate snug clothing is generally safe. Extremely restrictive clothing over long periods could reduce blood flow or cause discomfort. But for most men, wearing fitted underwear does not lead to long-term harm. Comfort, movement, and personal preference should guide clothing choices. The urologist notes that focusing on healthy lifestyle habits is far more important than obsessing over minor wardrobe choices. Myth 10: You should measure your penis to see if it's normal. Many men feel pressure to measure their penis to check if it meets a perceived standard. There is a wide range of normal sizes, and most men fall within this average range. Obsessing over measurements can create anxiety and negatively affect sexual confidence. The urologist emphasizes that self-worth should not be tied to size. Focusing on health, intimacy skills, and emotional connection provides far more satisfaction than numbers on a ruler. Myth 11: Ejaculation frequency affects penis health. Some believe that frequent ejaculation can weaken the penis or lead to sexual problems. The truth is that regular sexual activity, including masturbation, is a normal physiological process and does not damage the penis. Over time, maintaining sexual activity may even support prostate health. Problems only arise if compulsive behaviors interfere with daily life, relationships, or overall well-being. Myth 12: Penis appearance predicts sexual performance. Many men worry that appearance, shape, or color indicates sexual ability. Penis variation is normal. Curvature, color differences, or size differences are common and usually harmless. Performance is determined by physical health, psychological well-being, and communication with a partner, not external appearance. The urologist stresses that accepting natural variation can reduce anxiety and improve sexual confidence. Myth 13: Penis length grows with certain exercises or techniques. Numerous techniques promise permanent growth through stretching, jelqing, or other exercises. Scientific evidence shows these methods do not produce significant long-term growth and may even cause injury. Men who attempt such practices risk damaging blood vessels, nerves, or tissue, leading to decreased function. Consulting a professional is crucial for safe approaches to sexual health. Myth 14: ED pills work for everyone instantly. Many men assume that medications like PDE5 inhibitors solve erectile problems immediately for all users. In reality, these medications are effective for some, but results vary based on individual health, underlying causes of ED, and proper usage. They do not replace lifestyle improvements, communication, or addressing psychological factors. Understanding limitations and consulting a professional ensures safe and effective outcomes. It's time to stop believing the myths and start embracing the facts. Your penis health is influenced by overall well-being, communication, and self-acceptance, not by myths or misconceptions. If you have concerns, consult with a healthcare professional who can provide personalized advice. Remember, knowledge is power. Empower yourself with the truth. If you found this video helpful, don't forget to like, subscribe, and share it with others who might benefit. Stay informed, stay healthy, and take care of yourself.